Good morning, instructor and audience. Today, we would like to present about preliminary study of quantitative kinematics gait analysis in dogs with clinically normal stifle joint. Let's start with the meaning of kinematics gait analysis. Kinematic gait analysis is the study of the position, angle, velocity, and accelerations of joint during motion. During the gait cycle, when the stifle joint is flexed, the angle of joint gradually decreases until reach maximum flexions, which is the minimum angle. In the other hand, when the stifle joint is extended, the angle of joint gradually increases until reach maximum extensions, which is the maximum angle. And angular displacement during the gait cycle is called active range of motion, which is calculated by the difference between maximum and minimum angle. For example, this dog has maximum angle 162 degrees and has minimum angle 124 degrees. An active range of motions is calculated by the difference between maximum and minimum angle, so the active range of motion of this dog is 38 degrees. Quantitative kinematics gait analysis system is a potential tool for motion analysis. Because this system can capture, analyze, and draw hundreds of observations per second, and the data is not interfered with observer's perception. From literature revealed, there is no kinematics reference data of stifle joint in mixed breed Thai dog. So this study aimed to establish kinematics reference data of normal stifle joint in mixed breed Thai dogs while the dog is trotting. Because trot is a symmetric gait, that means left and right stifle joint should be equal. So the objective of this study is to establish reference kinematic data of normal stifle joint in mixed breed Thai dogs. 6 dogs with body weight between 13 to 20 kg were used as subjects. All dogs were just as clinically and radiographically normal in both hind limbs. And we use motion analysis to include the 11 reflective targets and 6 infrared cameras with resolutions 1280 multiply 1024 pixels, 60 Hz frequency. As you can see, the camera emits infrared radiations and receives the reflective ray that reflect from the marker. When at least 3 cameras track the positions of the same marker at the same time, software process and display information on the monitor. The last material is double-sided adhesive tape and 3M adhesive tape were used for tagging reflective target to the dogs. First, we made sure that dogs familiar with trotting in data collections area. Then each dog was tagged with 11 reflective targets on the skin, oval caudal to spinal process of L6, cranial dorsal to left and right iliac spine, greater trochanter of left and right femur, lateral epicondyle of left and right femur, lateral malleolus of left and right fibula, and lateral aspect of left and right fifth metatarsal bone. All dogs were leashed by the same handlers. Dogs' trotting velocity was maintained between 2.1 to 2.6 meters per second. Each dog was collected 6 trials from left hind limb, 6 trials from right hind limb, which is 12 trials in total. For data analysis, first, we link the dot that represent the reflective target to a stick diagram. Then filter the data with 10 Hz butterworth smoothing. The stifle angle is shown in the bottom half of the screen. After that, The data were explored and normalized to 101 data point on Microsoft Excel 2016. The normalized data were plotted as shown. As you can see, this is maximum angle, which is maximum joint extension, and this is minimum angle, which is maximum joint flexions. The difference between maximum angle and minimum angle is called range of motion. Then, use angle from previous slide to calculate angular velocity and plot as shown. Then use angular velocity from previous slide to calculate angular accelerations and plot as shown. We use descriptive statistics to characterize data. The normality tests were conducted by Shapiro-Wilk test, and parity test is used to determine if there is statistically significant difference between left and right stifle angle.
For reliability, each limb was collected 6 trials. Coefficient of variation is less than 10%. From the experiment, we found that mean minimum angle of left and right stifle joint are 108.232 and 109.31 degree. Mean maximum angle of left and right stifle joint are 158.58 and 156.22 degree. Mean rate of motion of left and right stifle joint are 50.25 and 46.91 degree consecutively. We use parity test in order to verify that there is no difference between left and right minimum angle of stifle. And maximum angle of stifle is also shown no different, as well as range of motion. From the statistic analysis, we can conclude that mean minimum angle is 108.69 degree. Mean maximum angle is 157.34 degree. Mean range of motion is 48.66 degree. Mean minimum angular velocity is minus 459.81 degree per second. Mean maximum angular velocity is 570.48 degree per second. Mean minimum angular acceleration is minus 13,411.67 degree per second square. Mean maximum angular acceleration is 12,900.88 degree per second square. According to our data, mean angular displacement, angular velocity, and angular acceleration of 6 normal dogs were calculated and plotted as shown. Let's move to discussion. As I've mentioned earlier, the coefficient of variation from 6 trials is less than 10%, which is reliable. This is coefficient of variation from first 3 trials, and as you can see, it's still less than 10%. So we suggest that collect only 3 trials should be enough for routine gait analysis. According to our result, there is no difference between left and right stifle joint. We calculate percentage of differentiation between left and right stifle angle in normal dog. The result is less than 10%. During the study, we accidentally found 3 dogs with subclinical lameness in hind limb. All dogs have percentage of differentiation between left and right stifle angle more than 10%. So we suggest that 10% of differentiation might be used as a cutoff for lameness detection in routine. Anyway, this is just a result from only 3 subclinical lameness dogs. It requires further study to provide more information. In this graph, y-axis represents angle in degree, x-axis represents percentage of gait cycle time. The dot line is an angular displacement in normal limb, and the blue line represents left stifle angle. The red line represents right stifle angle. As you can see in normal dog, Angle of left and right stifle run along the mean line, but an angle of abnormal dogs deviate from the mean line and show a symmetrical disease sign. This dog has right patellar luxation grade 1. The red line, which is an abnormal limb, is more deviated than the blue one. And this dog has both patellar luxation. The left stifle is the blue one. Is patellar luxation grade 2 is more deviated from the average line than the red one, which is patellar luxation grade 1. And the last dog, we found no lesion in both stifle, but from an orthopedic exam, the dog showed pain when the right hip was fully extended. This evidence indicates that the dog used stifle to compensate the pain hip. However, further study is required. We would like to thank Associate Professor Dr. Monchanok Vichansorn, Associate Professor Dr. Virawat Lim Rung Reung Rat from CSST Mahidol University, Dr. Irene Kwan Anosha, Mr. Thanisorn Bunyakong, Mr. Sarawut Yang Thara, Orthopedic Center, Kasetsart University Veterinary Teaching Hospital, and our devoted members. Thank you for your attention.